you for joining us for the ninth installment of Fulton County Department of Behavioral Health and Developmental Disabilities webinar series. I am Veronica Rooks. I am a program manager with the department in our Developmental Disabilities Division. And I have the distinct pleasure of introducing our awesome presenter for today. Moki Macias. Moki has served as the executive director of the Atlanta-based Policing Alternatives and Diversion Initiative, PAD, since its launch in 2017. PAD reduces arrest and incarceration for activities related to mental health, substance use, and extreme poverty through two strategies: law enforcement assisted diversion for individuals detained by police, and alternative response teams that accept referrals through the City of Atlanta 311 line. Moki received her master's degree in city and regional planning from the Georgia Institute of Technology and has spent over 15 years engaged in community organizing, engagement, and advocacy related to criminal justice reform and community development. More information about PAD can be found at www.atlantapad.org. Thank you all so much for joining us today. Should you have any questions, please feel free to drop them in our chat box. And without further ado, I would like to turn it over to Moki. Welcome and thank you so much.
Thank you, Veronica. It is a pleasure to get to present today about our work here in Atlanta and Fulton County with the premise really of creating safer and stronger communities through harm reduction. So I'm going to spend some time talking a little bit about PAD and how we do the work that we do, why we do the work that we do, and then you'll get to actually hear from both our other team members as well as our participants who we work with about the impact of our work. So if you want to advance the next slide, Erica. Awesome. So I'd like to start with the challenge, right? Why do we feel that we need a new approach to community safety and wellness? And I think what I'm sharing here is nothing that is actually surprising to most people. It's just that we have gotten stuck in our responses to some of these really challenging issues for our communities. So when we think about problematic substance use, when we think about people who are experiencing unmet mental health needs, when we think about folks who are navigating extreme poverty, we could probably, each of us could go into our own experiences, and we've experienced challenges ourselves. We have had loved ones experience these kinds of challenges, or we have community members that we know have experienced challenges with addiction, with mental health, and with navigating extreme poverty, right? The difference, however, is that for most of us, we are able to rely on a network of support, right? I've heard many times now from folks who work within the behavioral health field that the opposite of addiction is not sobriety, right? The opposite of addiction is connection. And so that idea that, in order to really encounter these very common challenges, right? And when we encounter them, to overcome them, it doesn't just rely on somebody deciding they're going to do something different, right? It doesn't just rely on having more resources. It also relies on getting connection and support from other human beings, right? And so that's really the premise where we start our work, that part of the challenge in our society today is that we have not, as a society, led with connection, right? Led with the idea that we can connect people to each other, right? That sometimes what it takes is people getting a helping hand, right? A supportive relationship when they need it to really make differences and make big changes in their lives. So instead, our current systems have really failed to provide, you would go back to thank you. So our current systems, they've really failed to provide that kind of care. for folks who needed it most, right? And we've seen this, right, in communities all over the country for decades. What has happened is that local and state governments have criminalized survival activities. They have said, you know, we don't have the safety net that we need, but we still have these issues. What can we do? Let's make them illegal, right? So here, in our own community, you can be arrested for public urination. You can be arrested and jailed for up to 6 months for asking for money, right? Panhandling. You can be arrested and jailed for sleeping on private property when you have nowhere else to sleep, right? And so we've seen this, it's not unique to Atlanta, but we've seen that in our communities, these sort of social issues related to substance use, mental health, and homelessness as one factor of extreme poverty are responded to through criminalization. And we're in a moment right now where our entire country sort of reckoning with what that means, right? How that has harmed communities, particularly African American communities and other communities of color, right? When we rely on the police department to be the go-to for every single concern that comes up, right? It's not fair to our communities, and it's also not fair to police, right? That the expectation is that, anything that is a challenge within community requires a police response, and then the police are expected to show up and sort of solve a problem that they're not equipped to solve, right? With very little resources, actually, in terms of housing, in terms of behavioral health care, et cetera, right? And where that is not their training, right? To be able to have those conversations with somebody that is experiencing a serious mental health concern, and be able to really sit with them long enough to kind of get them into a comfortable space to then be able to connect them to care. That is not the role of law enforcement, and yet we consistently ask law enforcement to play exactly that role, right? And what we know is that this sort of cycle of arrest and incarceration, it doesn't actually address the issues, right? So community members are frustrated, the police department is frustrated, family members are frustrated because they know their family member is not getting the help they need, and the people themselves that are the most marginalized, right, that have been surviving in really terrible conditions, right, and have often engaged in criminalized activities because of it, the people themselves are pushed even further to the margins, right, pushed further away from the connections and the resources that really would truly help them get into a different path, be able to have more stability, be able to access healthcare and other resources, right? And so we're kind of stuck in this cycle, right? That if we do not invest in the community resources we need, then we will continue to, and our response is only punishment. Then when people are punished, they will come back out of jail and still not have the resources they need, right? And so what we are trying to do is, a small part of the solution, right? It's not everything, but what PAD sees our work to be is to sort of intervene in those moments to provide an alternate response so that we can stop relying on punishment to address issues that really affect our communities. Next slide. So that's what we do at PAD. We're a new approach to community safety and wellness. PAD stands for Policing Alternatives and Diversion Initiative. It's a mouthful, so we like to call it PAD. But basically what we do is we try and address these kinds of concerns, right? Concerns that I mentioned, those related to substance use, to mental health, or extreme poverty. And at the same time, we try and reduce arrest and incarceration of people who are experiencing these issues, because we know that that doesn't actually solve the problem, right? And then we work hand in hand with our local governments, very closely with Fulton County Department of Behavioral Health, very closely with the City of Atlanta government, very closely with social service providers that are all working together to just try and increase the accessibility of supportive services, right? We know that just an alternate response is like one step in the right direction, but what we truly need is we need a response that then connects people to the kind of care that they truly need. So those are really our goals. We do this through two ways. The first is that we provide an immediate alternative to arrest when somebody is already detained by law enforcement. So we have a partnership with the Atlanta Police Department, with MARTA Police, and currently we have a partnership with the Georgia Tech Police, We're in conversations with other universities in town to be able to provide a similar resource to those universities as well, colleges and universities. But what that looks like is that if an officer with any of those departments is engaging with somebody who they know, there's some violation, a law violation has occurred. They do have probable cause to arrest because of it, but they know that the issue is driven by a mental health concern, a substance use concern, or extreme poverty. Then they're able to make a different choice, to use a different tool, right? Instead of arresting and booking the individual in either Fulton County Jail or the Atlanta City Detention Center, the officer is actually able to call a harm reduction team through PAD. Once the officer raises that team, the team will come out. It's a two-person team. Our teams will come out and they'll have a conversation with the officer and they'll have a conversation with the individual. And it's a consent-based program. Nobody is forced to participate, and there's no specific requirements for when they do. We really try and build a plan with somebody based on what their immediate and individual needs are. And so once an officer makes a connection to us, that's a pre-arrest diversion. That is not through the courts, and there is not actually an arrest report generated. And so it is truly sort of it's a pathway out of the criminal legal system before somebody actually goes in. But we know that oftentimes police officers are truly the people that are having that first engagement with folks that really need much more support and access to services, right? And so through LEAD, which is Law Enforcement Assisted Diversion, we're able to work with the local police departments and then able to work with our local prosecutors and public defenders' offices to help navigate if there are other legal issues already present. Oftentimes, the folks that we are working with are folks that have been arrested many times. They may have open cases already. They may have warrants already. So we'll work with our criminal legal partners to be able to address some of those barriers. Because oftentimes it's actually barriers like that that prevent somebody from getting a job, from getting into stable housing and that sort of thing, right? So we work with people on all sorts of things. Legal issues, we work with folks on getting identification or documentation, on getting access to Social Security or disability benefits, on getting access to healthcare and housing. Those are really our primary focus. I'll share a little bit more about that in a moment. The other thing that we do is work closely with the City of Atlanta's 311 line. So I'll explain more about this shortly, but the 311 line for the City of Atlanta is the non-emergency line for city services. What we're able to do is develop a partnership with the City of Atlanta to be able to allow folks to call, community members, to call 311 and actually ask for assistance related to these same concerns, right? Substance use, mental health, or poverty. And so when an individual calls 311, what actually happens is that the 311 agent will get some information, and if it's appropriate for a PAD team to go out, our PAD harm reduction team will actually go out to the scene and engage the individual through outreach. If we make a positive connection with that individual that was referred, we'll start working with them to connect them to resources similar to the ones I already described. Next slide, please. Thank you. So I want to just take a moment and say, the reason that we have been successful so far is because this has been an absolutely collaborative effort. So PAD came out of a collaboration between the City of Atlanta and Fulton County back in 2015, and we actually launched in 2017. We were able to basically develop our strategy through working very closely with stakeholders in the county and the city and community members who were interested in this project because they themselves have been directly impacted by incarceration in our local jails, because they may be providing services as service providers, or because they had been advocating for local criminal justice reform through various organizations. So this really came out of a local campaign with the Solutions Not Punishment Collaborative that then led to a design process where it was a big tent. We pulled people in and we had a lot of conversations about what is an approach that we can take collectively that will allow us to start shifting the tide, right? To start sort of turning the tide away from simply arrest and incarceration and towards more connection to services. So similarly, our community referral process, which was just launched this past January, was also data-informed, community-driven, and collaboratively designed. So last summer, actually, we began the process of looking at what would it look like to respond to these same types of concerns without police involvement, right? And so we looked at 911 call data. We looked at the calls coming in to the 911 system that could possibly be more appropriate for a non-police response. Many of those calls were calls that were likely related to substance use, mental health, or extreme poverty, and probably did not need an armed police officer to arrive to the scene, right? We figured that if we could sort of recruit those calls into the 311 system, people would be getting to choose for a different response, and it would also release some of the pressure on the 911 system to be able to handle the overwhelming number of calls that do come into the system. We also held listening sessions, we surveyed residents, and we collaborated with our existing partners in the city, the county, and private agencies to really design protocol that we thought would make this process as effective as possible and as accessible as possible, so that community members really could pick up the phone, call 311, and get some immediate support. I want to just note that while we work closely with Fulton County, we have focused our expansion in the city of Atlanta. And the reason that we've done that is because we recognize that that many of the concerns are concentrated within our city core that will end up leading to somebody being incarcerated at either Fulton County Jail or the Atlanta City Detention Center. The Atlanta Police Department is the largest arresting agency that brings people for booking at Fulton County Jail. I believe it's somewhere between 40 and 50% of all people booked at Fulton County Jail have been arrested by the Atlanta Police Department. So our partnership with Atlanta Police does not only benefit residents of the city of Atlanta, but it also benefits the entire county of Fulton County, because we are directing people out of an overcrowded jail and into community-based services. Next slide, please. Wonderful. So I'd like to share a little bit more about community referrals. And I'd like to focus there just because our law enforcement assisted diversion services are services that are really accessed through the police department. The police department has to already be engaging with an individual, has to have probable cause to arrest, and then makes the decision with their own discretion to call us instead. The difference with 311 is that community members can choose to call 311 instead of 911, and can choose to request assistance with an issue that they're dealing with without the involvement of the police department whatsoever. So I want to share a little bit about what that looks like. I'd like to share just a testimonial from one of the business managers that has called us quite frequently. And I think what we've found is that many people are really interested in identifying ways that they can get resources to people that they see often, right? So there's often, the same handful of people that may be in an area because that's their neighborhood. They may not have housing in that neighborhood. They may be experiencing homelessness, but that is truly still their community, right? And so oftentimes community members that call us have identified that, these are folks that they may know their names, and they really know that it's going to be a longer process to get somebody into care and support. So they're really eager to try something different when before they've just been told, oh, just call 911. If you have an issue, just call 911. What we see now is, we'll be at neighborhood meetings or on virtual neighborhood meetings, and our police department representatives will actually say, if you have a concern related to quality of life, try 311 first. If you need us, you can always call us at 911, but start there. And so that's really what we see many of our community members doing today, is starting with 311 to try a different approach. And I'd actually like to start with a video that will talk a little bit more about our 311 Community Services. One moment. Okay.
I've seen how it can go in the community, how things can take a wrong turn. Something has to be done.
So we have this video of this dude.
I'm sorry. Let me make sure. Could y'all hear me?
Yes.
You could hear the video? Okay. I just wasn't sure if I had done it, and then I was worried that I hadn't. Okay, let me try again. Thank you. Let's start from the beginning.
I've seen how it can go in the community, how things can take a wrong turn. Something has to be done.
So we have this video of this dude. It's a white guy in his 30s, and he's been coming up in our yards over here and just checking locks and looking for stuff to steal. At our NPU meeting this week, they mentioned this new program, so we thought we'd try to take advantage of it.
Okay, yes,
I
sir.
appreciate you coming out.
Yeah.
I'll show you where the guy is.
Yeah, please.
It's a white guy, dark hair. Behind these cedar trees.
Hi, my name's Norma. I'm from PAD. You need some help? You need some help? Because we don't want the police to come along and take you away for something that's not necessary. You need some help?
What we do is provide an alternative to arrest for people who are experiencing homelessness, mental health, or substance abuse issues.
You're welcome. You're welcome. Are you looking for anywhere to stay?
We're first responders in a way.
We work with an agency called PAB. If you all ever have any needs as far as like, housing, shelter, food, anything like that, you can actually call 311 and just let them know what's going on, and they'll transfer you guys to us. We're really like in place to help people. Sometimes police will be out here and like messing with everyone, so we're kind of an agency to step in to prevent that from happening and actually help people.
311?
311, yes, sir.
It's PAD.
Yeah, yes, sir.
I went down and lived under the freeway in the tents there down there and got in trouble there.
The jails are full of people who have charges related to them just not being able to cope with whatever their mental health issue is or whatever their social health issue is. Instead of people being given the things that they need to resolve those challenges, they're thrown in jail. Maybe that's something that we could look into, like where we can order or ask for or do like a blanket drive so that we always have.
I would think so.
I would too.
Once we're finished getting them settled and meeting their immediate needs, they're assigned a case manager or care navigator that can provide some type of wraparound services.
This work is really a part of me because I myself have struggled with mental illness. I actually went to college on a band scholarship to play the drums and to get to band camp, and I'm not able to keep up with the demanding schedule because of where I was at mentally. That was a dream that I had to let go because I wasn't ready to handle it at the time. I feel like that gives me a certain level of empathy when I'm looking at some of these individuals and working with them, because I'm like, you know what, I really can see myself in them in a way. If you really get to talk to some of these people that are in some of these situations, you see that they have a lot more potential than the level that they're operating on.
Really, sometimes people just need to know what they have access to, and they need a helping hand to guide them to whatever that resource may be, because one little thing sometimes can make a difference in someone's life.
Yes, sir. No problem. Have a good one. All right. All right. Y'all too. All right. Take care. Exactly. Yes, sir. Okay.
So that gives a little taste of, sorry, no, no. Sorry. Washington Post kept playing. So yeah, that gives just a little bit of an introduction to our community referral services. Brandon and Norma are two of our harm reduction specialists who respond to both these concerns that come through 311, as well as to concerns that are diverted to us through the police department. If you could go to the next slide, please. Thank you. So I just want to mention what kind of concerns are eligible for community referrals. And, there's some overlap here. And, oftentimes we tell people to go ahead and call 311, even if they're not sure, because the customer service agents with the City of Atlanta 311 line are wonderful. They are very aware of the other resources available, and they'll really try and figure out what the best, where the best place is to direct the call. So what we find, though, is that the kinds of referrals that we are most effective responding to are those that are related to disturbances, to public indecency, mental health, substance use, basic needs, welfare, and public health. And so, when you think about what you may see within your own community, oftentimes, we may assume that somebody is experiencing a mental health crisis, or we may assume that somebody is experiencing homelessness just based on, how we perceive them, right? We really encourage people to, first and foremost, be willing to have a conversation with someone who's in your neighborhood, right? Have that conversation with a neighbor to be able to identify, like, hey, if you're concerned about somebody, saying hello is a place to start, and trying to see, what's going on for that individual, and if there's something that you can do as a neighbor, right? What we encourage people to do when reaching out to 311 is to call us if this is something that it's just not really something you can handle on your own, right? Like, just a neighborly approach is maybe you're not comfortable taking that approach because the person seems to be pretty agitated, or because they seem to have a lot of stuff with them and you're not really sure, you're concerned about, maybe trash or refuse, or if there is, if it's getting kind of messy or smelly, like if there's just, it feels a little bit overwhelming, that's an opportunity to reach out to 311. What folks do when they call 311 is they're really making a referral for outreach services, right? We are not law enforcement. We are not there to enforce the law, right? Our teams are really designed to come out to do street-based outreach and have a conversation with that individual to say, what's going on with you today? How can we help you today, right? And we have the ability to provide really direct services like a warm meal, clean clothes, a MARTA pass, as well as connect people to emergency shelter support. And so we use both the shelter resources that are through our public partners, as well as private partners that we have arrangements with. So we're able to provide direct housing support depending on what their needs are. And then it depends on what they need, right? If somebody really needs, it's clear that it would be really helpful to have a little bit more support for that individual. And if they're open to it, right, it's consent-based. So the individual really needs to feel comfortable and feel like, okay, yeah, I'm willing to have a conversation with you. Then we are able to connect them with one of our care navigators. You'll hear from one of our care navigators in just a moment. But the care navigation work is really more like intensive case management, right? We're really helping people navigate various systems over a longer period of time as they try to, achieve their goals for enhanced stability. In terms of increasing awareness, we actually have a survey right now that we'll put in the chat where individuals can just, let us know kind of what their concerns are in their neighborhood, learn a little bit more about 311, and give us any feedback on if they have used 311, if they're interested in using 311 for concerns like this. So we're advertising that way. We're also advertising through social media and working closely with our city council members to get it out into their districts. Always open to doing more. We regularly attend the NPU and neighborhood meetings, but we are trying to get the word out to let people know that this is a resource. And it's actually really unique in the country. I think we're the only city in the country that is accepting these kind of referrals through the 311 line, as opposed to trying to divert from 911. So that is something that, we pride ourselves on, and, we're continuing to learn because it's still very new, but we are, trying to really get people to use this service instead of continuing to involve police where they're not necessarily needed. Next slide, please.
Moki, we have a couple questions in the chat box. You've kind of touched on some of it a little bit, but I just want to read them to you. So one question: what could citizens do to help increase awareness and donate clothing, basic essentials? And then also, how is 311 advertised?
Great. Yeah. So in terms of 311, it is, we are trying to get the word out as much as possible via neighborhood meetings, social media, and various events where we can sort of tag on and give people the heads up. Always open to doing more community engagement. We're also actually going out and knocking on doors, focused mostly on businesses, but engaging with business owners to say, hey, listen, if you have concerns around any of these issues, try 311, and we can see if our team can come out and support you. We found that many business owners really appreciate that resource. For the first question, in terms of how can community members help increase awareness, one thing would be to do our survey. Thank you, Veronica, for posting that in the chat. To do the survey and to share it. Certainly to follow us on social media and repost. All of our handles are PAD Atlanta, which I can also put in the chat. And then in terms of donation drives or other clothing drives or other donation drives, we are always welcoming donations. We actually have a link on our website, which lists our wish list. And there's the contact information for who you would coordinate with if you were able to do a donation drive or had any items to donate. Currently, we are looking specifically for any men's clothing, particularly clothing that could be more like formal wear. We have suits, but we are looking for just nice men's clothing of any and every size. So if you go to our website, it's in the link here. You would be able to navigate to our donation wish list. In terms of promoting on local radio and television, we have certainly had some good media representation through WABE, a local news radio, through the AJC, and through several of our local stations. So we'll take the media where we can get it, just so that we can keep getting the word out. All right, I want to share just a little bit more about what happens when someone calls 311, because I think it's important just to note that, while the partnership between PAD and 311 was an opportunity to provide our harm reduction services directly to community members, we felt it was also an opportunity to work with 311 to help community members access other services that exist, right? We are, as I said earlier, only one part of the solution. And so we want to make sure that we're collaborating with our other partners to ensure that support. And so just to kind of walk you through it, if an individual calls 311, you would select option 1 within the city of Atlanta. You'd select option 1 for referrals related to substance use, mental health, or extreme poverty. And then the customer service agent will ask some questions. And they have the ability to, if they identify that this is a medical emergency, they will reroute that call to 911, or they'll advise the caller to go ahead and call 911. So we've had folks call for instances such as, there is a gentleman who's passed out on the bench. It doesn't look, he looks unconscious. That's a call that should absolutely go to 911 as a medical emergency. So that call was rerouted there, right? So they have the ability to reroute for 911 calls. They also have the ability to reroute to United Way 211, right? And so with that, it's, if somebody's looking for resources, if they're saying, oh, I'm having a hard time paying my rent, I'm looking for rental assistance, or I need legal support, or, I'm staying at a shelter now, but I want to see what other shelter options are available. Those kind of requests where referrals can be provided over the phone are rerouted to our partners at United Way 211. The other thing that the customer service agents can do is route folks to access phone support. And so as folks may be aware, we are in Georgia, we have the Georgia Crisis and Access Line. GCAL, as it's affectionately known, is the crisis and access line for the entire state, where clinicians answer the phone. They are able to actually do assessments over the phone with anybody who's in crisis, and then identify what resources are available in real time, right? Whether that's detox beds, whether that is psychiatric support or other inpatient support. They're able to identify what support may be needed with that conversation. And then if needed, they're also able to send out mobile crisis teams. And so, if anybody who's called GCAL is, probably aware, it is, they have to ask a lot of questions. You may be on the phone for quite a while, and you may need to wait for a mobile crisis response team for up to an hour. But it is an excellent resource if that is something that someone needs. What the customer service agents with 311, when they tend to refer to GCAL, it's usually somebody who's calling either on behalf of themselves or on behalf of a loved one. It's a little bit harder to make a referral to GCAL when you're just a passerby on the street, right? Because you really need to stay with the individual. You have to get a lot of information from them and that sort of thing. So, but we have had instances where, somebody has called for a loved one who may be, experiencing suicidal thoughts, for example, and then we were able to connect them through the 311 line as a warm transfer to GCAL. We also connect people, or I should say the City of Atlanta 311 customer service agents also connect people to the Georgia Council on Substance Abuse CARES warm line, as well as the Georgia Mental Health Consumer Network's warm line, which is peer-to-peer warm line. And those warm lines are really, they're an opportunity for people to just call and have someone to talk to, right? So that they can say, I'm dealing with a mental health concern, and I don't want to go to the hospital, but I just, I'm really having a lot of hard thoughts today. I need someone to talk to. That's the opportunity to really connect to somebody who's been there, who can offer hope, who can offer encouragement. Similarly with substance use, right? So especially when somebody's calling for themselves, but also if somebody's calling for a loved one, sometimes the customer service agents will refer to phone support through the warm lines. Now, last but not least, they also make referrals to in-person services. For folks who are calling for themselves or for somebody that they know, they will remind people that you can access services at the Gateway Center here in South Downtown, and also at the Fulton County DBHDB service centers, right? So usually we direct folks to the one on Boulevard. And so, we make sure and let people know there are places that you can walk in for support. If somebody's calling for themselves, actively seeking support, we really try and direct them to those existing resource partners. Now, if somebody's calling for somebody else, that is usually when PAD gets sent out, right? To do that sort of in-person outreach, to try and identify what the needs are and connect them. And we're really looking at those instances where, if PAD were not to go out, it would be likely that the police would have to go out, right? Or would be called out. And so just as an example, oftentimes we get calls when somebody may be really agitated, they're yelling in front of a business, perhaps they're not wearing any clothes or they've soiled themselves. And it's an untenable situation for the business owner, but they also know that this person is going to really benefit much more from some sort of harm reduction, right? From identifying what's going on in the moment and helping to reduce that concern, right? Rather than what may lead, police involvement, which may lead to arrest and incarceration. So the other option is that, for encampment concerns, like if there's, multiple people that have set up sort of an outdoor living space, those concerns are directed to the mayor's office, because they collaborate with various partners to address encampments, and they have a whole strategy for that. So that's not really something that we're involved in, but we do respond, as needed when folks are living outside and, maybe causing a disturbance or another concern, where we can do outreach too. Right now, our community referrals are, as well as our law enforcement assisted diversion, is available almost all over the city of Atlanta. And so we follow the APD zones as kind of our areas. We are in every zone except for zone 2, which is sort of the Buckhead, North Atlanta area. That is the last zone that we're expanding to, and we'll be up there by June. So by the end of June of this year, we will be citywide in the city of Atlanta for all of our services. If you'd like to know which zone you're in, you can go to our website, and it'll direct you to the APD link where you can just type in your address and you'll be able to pull up your zone. So we're available in zones 1, 3, 4, 5, and 6, with only within the city of Atlanta. So at this point, we're available to Fulton County within the city limits. We have a partnership with Fulton County Department of Behavioral Health. We're a partner on a federal grant that is going to allow us to expand our services for law enforcement assisted diversion into both South Fulton and North Fulton in a pilot project starting next year and then the year after. So we are slowly getting to move out into other parts of Fulton County, but for now we're concentrated on expanding citywide, being able to provide those services there, and then hopefully taking that model and being able to do it in other cities across the county. Next slide, please. Awesome. So I want to spend a few minutes just talking about our approach, because it really is what makes us different, right? It's very different to get diverted into a program through the court and be told, okay, you have 6 months. You can't use drugs. You have to, be in housing that requires a curfew, and you have to check in with somebody once a week, right? Or any number of different expectations, right? You have to do drug tests. You have to do, various appointments, right? You have to be on medication, right? There's oftentimes with diversion programs, there are a lot of strings attached, right? And what we see is that works for some people, right? But it doesn't work for everyone. And that many of the people who are surviving on the street, who may not be managing their mental illness if they have a mental illness, who may not be managing their substance use well, are folks that doesn't work for them, right? Those kind of programs that sort of demand X, Y, or Z don't necessarily work for people. And I want to say a word here about substance use. The idea that, within so many programs, there's the expectation of abstinence, I think is really important for us to sort of think about critically, right? Because it's actually kind of illogical, right? That, okay, you're going into a 3-month treatment program. Ideally, by the end of those 3 months, right, the expectation is that you will no longer need to use the substance that you are currently using, right? That you will have stopped using that substance. But the condition of participating for those 3 months, starting on day 1, is that you don't use that substance. How absurd is that, if we think about it, right? How absurd is it that actually the condition of treatment is actually the same thing as the goal of treatment, right? And so that to me is really the kind of crux of why, instead of abstinence, right, we use the idea of harm reduction. And for some folks, they still want to do abstinence. We support that. We will get folks into programs that are much more focused on abstinence. But what we offer people is the idea of harm reduction, the idea that any positive change is a good thing, right? So if you have a $400 Coke habit, right, $400 a day, and your goal is, I'm going to actually reduce my use. I'm going to use at different times of the day, let's say, so that I'm reducing my usage to now I'm spending $200 a day on my Coke use, right? That is a positive step, right? Because why? Because you are in conversation with somebody who is helping you identify how you could reduce harm to yourself, right? That may be helping you think about, like, when am I using? Who am I using with? What am I using? Who is my supplier, right? Thinking really strategically about ensuring that you are being as safe as possible within your drug use, right? But not only that, if you've gone from a $400 a day Coke habit to a $200 a day Coke usage, you have $200 a day that you may be able to use to meet all of your other needs, right? And so in that way, that's kind of a dramatic example, but that's what we do with folks. We really identify what are the things that you want to change, and then what are the baby steps, right? And we like to say here, what are the kitten steps, right? We're not even baby steps. What are the kitten steps that we can take together to help you get there, right? And it relies on being honest. It relies on being non-judgmental, but I'm being really clear with folks like this. These are what you want to. This is what you want to accomplish. This is what it may take. What do you think you're up for, right? And helping people really gain their own sense of autonomy and dignity back when it has often been denied. It has often been denied to them, whether through the experience of incarceration or through the experience of social service providers that decide that because they're helping somebody, they're going to tell them what to do, right? So I want to share a couple videos here. I'm kind of closing out here, but I want to share a couple videos so that you can hear from our providers, our team, about what harm reduction is, and then to hear from Mr. Larry, who is pictured here on the screen. He's one of our longtime participants. He was diverted to PAD in April of 2020. And he is now permanently housed. He has an apartment on the Beltline. He loves to ride his bike and watch people, do people watching on the Beltline. But you'll get to hear a little bit from him and his care navigator, Devona, as well. So if I could, I'm going to share a couple videos here. Okay.
Hi, I'm Beverly Fernandez, Care Navigation Supervisor at PAD. I'd like to start by talking about the principles of harm reduction, as this is the fundamental core of the PAD program. Harm reduction is the idea that we can make small positive changes now that eventually lead to bigger, more permanent changes in our behavior. And as people become more stable, it improves the health and safety of our community as a whole. Now, this might sound abstract at first, but all of us practice harm reduction. We all engage in risky or dangerous activities, but we are given tools to make those activities less harmful. Whether it's putting on your seatbelt, adding sugar-free sweetener to your coffee, or wearing a mask. As public servants, we usually hear about harm reduction in the context of illicit drug use. An example of this is needle exchanges. Handing out free syringes isn't to encourage people to use drugs, but rather it keeps people safe and reduces the spread of HIV and other diseases. An added benefit to the harm reduction approach is that people feel less shame, which makes them more likely to speak openly with their care provider. Honesty and trust are the first steps to building a healthier lifestyle, and we're here to support them through all stages of their recovery.
And we're going to actually keep on going and watch the next one here to hear from Larry and Devona.
Every time I went to jail, it had something to do with my drug addiction. I would be wide open out there on the street, stealing, smoking dope, drinking, acting a fool. Over the last 25 years, I ain't never just had a clean run without police stopping me or locking me up for something. So I've been doing pretty good with PAD.
very proud of him. He doesn't give me any strife about going here or going to there or applying for this or, you know, whatever it is that I ask him to do, he is humble in doing it.
Before PAD, I was always in denial about mental health issues until Ms. Frazier said, well, listen, everybody has some kind of mental health issue. That don't mean that you're crazy. She's been very helpful. You've been very helpful to me.
Like, I try to keep my boundaries. However, when people are going through crisis, it's not just Monday through Friday, you know, and if all it takes is a conversation, then I'm willing to do just that.
Right. I think we have just one more slide just to close us out. Thank you. So that's sort of the gist of it, of what we're doing. I hope that maybe raised some interest in PAD. There's a few ways to learn more and get involved, and I think these links are going to go in the chat as well. We are doing a survey now for our 311 community referral services. I'm really focused on, again, City of Atlanta residents, looking to get people's perspectives on the challenges in their communities and how they would use 311. We've actually just released our quarterly report for 2021, our first one. That's there on the in our website. Our video, which I shared, the first video I shared, is linked there as well. It's also on our website, and you can learn more about PAD and how to get involved, including donations. And I'll post the specific link for our wish list there. We love accepting donations for participants. There's always something that we need. So thank you.
Thank you so much, Moki. Your presentation was really informative. Even me working within the department, I learned something new today about things that I didn't know as far as the PAD program. So I want to open the floor up for anyone that may have any questions for Moki.
There was one question in the chat earlier that asked, does PAD accept volunteers?
We do accept volunteers right now on a very limited basis because most of the volunteer work has to be done virtually. And so if somebody has a specific skill that they're able to provide, such as, we've had a volunteer do photography for us. We've had volunteers assist with data collection for us. So if there's specific skills that people can offer, or even just like doing a donation drive or helping to spread the word on social media, that's definitely an opportunity. Once we are back in the office full time, we will definitely be looking for more volunteers just to support sort of hospitality in the office and working more closely with our participants. Right now, most of our work is done as field-based, community-based work. Awesome. But actually, I should mention on the link that I just shared, the Join Us link, there's a survey that you could fill out if there is an interest. There's a survey that can kind of share availability and skills for anybody who's interested.
Okay. Thank you. Any other questions?
Question. Moki, outstanding presentation. I learned a lot. And I'm sure Erica's going to mention that we are recording this to post on our website so people can see it. Have you presented to the Midtown Alliance? Because they would be very interested in this.
Yeah, actually, we have. We've presented at the Midtown Alliance. We've presented at the Midtown Neighborhood Association. And we've actually been featured in a few of their public safety, kind of specific public safety events. But we're always willing to come back by and do another presentation or have another conversation. We do work with Midtown Blue as well, the police, police force in that area around some of the issues that they've seen as well.
Have you been on Good Day Atlanta?
No. Mm-mm.
I will email you the producer, the name of the
Great.
producer.
That would be awesome. Yeah, thank you for that. That would be great.
Thank you, Brian. Any other questions for Moki? Okay. Thanks again, Moki. If anyone is interested in a copy of the PowerPoint presentation that Moki went over, please put your email address in the chat box and we'll send that over to you. As Brian stated, we will have a recording of this presentation put up on our website at fultoncountyga.gov. And you can navigate from services to the Behavioral Health and Developmental Disabilities Department. Also, please join us for our next webinar presentation, which is on May 27th at the same time at 1 p.m. And that presentation will be on moving through grief and loss. And so with no other questions, thank you again, Moki, for joining us today. We so enjoyed your presentation, and everyone have a great afternoon.
Thank you.
Thank
Appreciate
you.
it. Bye-bye.
Bye.